They're astonishing numbers that have health officials on alert. Sexually transmitted infections are on the rise. Partially to blame is that less people are using these, and Toronto may have some of the highest rates in the province. Chlamydia, gonorrhea, and syphilis all up significantly across the province and in Toronto.
When you're starting to see, over 900 cases of syphilis, it is quite high compared to where we were previously. So it is, concerning.
In only 1 year, chlamydia rates rose from 8,300 reported cases to 8,900. And over the last 10 years, it has increased threefolds. Also concerning gonorrhea, which saw massive spikes in Toronto from just over 2,000 last year to 2,800 now.
The highest is, as I said, chlamydia. So we get over 10,000 cases annually, and so that's definitely, when we put the STIs together, they account for 2/3 of all of the infectious diseases that are reported to us. So these are high volume diseases in the city. It's been around for a long time, and rates were really low, and then now there's been this resurgence. So it's kind of a re-emerging infection. And it is a disease that, can cause some significant health outcomes.
Toronto Public Health attributes the reasons we're seeing more STIs in Toronto to a change in sexual behavior, with more people open to having multiple sexual partners. Also, officials say a major contributor is less people are using condoms.
There's lots of theories and hypotheses, lots of research going into this area right now. One reason why we're seeing more cases is that we have better diagnostic tools. So the testing has become more sensitive. We can detect cases more readily and in different parts of the body as well, where people can get these infections. But probably a bigger component is changing sexual health behaviors over time. And so that would be people perhaps having more sexual partners that are not necessarily mutually monogamous, and then that creates kind of sexual networks where these bacteria can be transmitted from person to person.
Officials say many of these infections can cause long-term health issues. Now, coming up, we speak with a dating expert who says partially to blame could be Toronto's so-called hookup culture. We've been talking about the increase of sexually transmitted infections in the province. Toronto is seeing an increase of people being diagnosed with things like gonorrhea, chlamydia, and syphilis. Toronto Public Health says Toronto has the highest rates of STDs.
We have a big population as well, and we have a young population, and so STIs tend to be concentrated in younger people. So there's lots of factors that contribute to that, but yeah, Toronto certainly has higher rates than the rest of the province.
Is there a particular age group where we're seeing most of this?
So young adults like, age 15 to 29 are kind of the age group that's most affected with STIs.
Now, Tab says the development of what she calls singles neighborhoods popping up in the city could be partially to blame as well. Toronto Public Health urging people to get checked out frequently in order to make sure that they are safe. Do you find that people are coming to you with this concern about hookup culture being a dominant thing here in the city?
Yeah, a lot of clients that come to me post-online dating are having obstacles finding quality partnerships, and that's why they seek out a matchmaking service. I think people are getting involved quickly and sometimes have sex too fast, and that's leading to like you said, STIs and stuff like that, because they're getting tested less frequently, and this is causing a trend to have it more spread. If you are, getting to the point where it's, you want to be with this person and you are having sex with them unprotected, you need to have a conversation and ask the questions you need answers to, like, are you sleeping with other people? Because you want to protect yourself and you want to be safe. And a lot of people are scared to, have those conversations. And if you're not having those conversations, then you don't really know what's going on or who this person's with, right? So you really want to protect yourself.
Now, as mentioned, a number of things are playing factors into those numbers. Again, Toronto Public Health urging people to make sure that they're getting checked out frequently because some of these symptoms don't pop up right away.